Dr. Brent Reynolds here. I'd like to answer two questions I get quite a bit of. The first one is, are you Dr. Phil? Which is inexplicable that someone would confuse me for Dr. Phil. I mean, that dog don't hunt. Number two, what is BrainCore therapy? Now, what BrainCore therapy is a technology, computerized technology system that allows us to do neurofeedback with patients. Now, what is neurofeedback? Neurofeedback is a training for training our brain waves into normal patterns, or better patterns, or improving the function of brain waves. Now, what are brain waves? Brain waves are basically a collection of the recording of the firing of our nerve cells in our brains that can be measured with a little sensor like this over the scalp, and it measures those patterns. So brain waves can be slow or fast. And so for different tasks that we're doing. For example, when you are paying attention to something, your brain waves have to speed up. To go to sleep, the brain waves slow down. So suffering comes when we want our brain waves to slow down, like to go to sleep, and they stay up here. They stay fast. We call that insomnia. Other times when we want to pay attention and our brain waves can't speed up, we may call that attention deficit. Now, there's a host of disorders that fall within those, that different brainwave patterns are cause those disorders. So we were interested in the functioning of those brainwaves. Once we improve brainwave activity, a lot of times these symptoms go away as a result of the improvement of the brainwave pattern. So how do we read the brainwaves? How do we know? We do what's called a QEEG. We basically put a little swim cap on looking thing that has these sensors inside of it. It measures 12 different areas, and it tells us where in the brain that there are slow or fast or abnormal or normal brain waves. So for example, if I have slow brain waves over this particular area of the brain, it may be causing me to have attention deficit problems. And so what the therapy is, or what BrainCore, the training is we have the person hooked up, the sensors hooked up to the computer, and whenever I hit or increase my brainwave activity in this area, I get rewarded. What do I get rewarded with? I get a cookie. No, I'm just kidding. I get what we do with BrainCore in particular is we have the person hooked up to a TV screen. They're watching their favorite DVD. They could be watching a cartoon, a comedy, Meet the Fockas, I got my eye on you, Focka. Whatever they want to watch. We just recommend they don't watch violent TV shows, but the content's not necessarily important. The motivation to watch it is. So as I'm watching the TV screen and I hit this mark, it reads and says, oh, he increased his brainwave pattern, the screen gets bright. And if I look away or I think about something different, the screen goes dark. Screen goes bright, screen goes dark, bright, you get the picture. So over time, what it does is it tells the brain that it gets rewarded every time it does something good and improves that brainwave activity. So if I want to watch that show, I want it to be bright and so I can hear it and everything else. And so what that does is, what it's doing is actually firing those nerve cells differently. And when they fire differently, they wire differently and they wire together. And so that's actually called the changing of the brain via the nerve cells is actually called neuroplasticity. And we're talking about a permanent change in the brain down the road to reduce the symptoms, not just treat the symptoms. So that's why there are no side effects with neurofeedback, because it just improves the weakest areas in the brain. So if you have any questions about that, feel free to call our office or find us online, newlifechiropractic.com, and give us a call, 631-265-1223, or call your local BrainCore doctor and ask questions, and have a nice day. I hope this helped, and in future videos we're going to try to talk about more detail with like the testing and the brainwave patterns and research and things like that. So take care.